Hello, everyone, and welcome to the Knowledge Point check of the weekly learning objectives. So this week we focused on male and female. So what I wanted to do was just make sure we look at some familiar terminology and then look at some example questions to get you on your way to being successful with this week's assignments, tests, and studies. I want to focus on some of the weekly objectives with the focus exactly on the discussion question. Remember, each week you have a discussion question that is due. Okay, so I have a checklist here to help you. Some people always want to know, how do I get full points? Well, let's just listen carefully and follow along. And you can see how you can be on your way to earning full points for your discussion question. So here's a little bit of discussion help. So we're going to use this checklist to help you manage your time and meet all of the discussion requirements. Now you see the first criteria is before Wednesday. So before Wednesday midnight on Eastern time. What do you need to do during this time period? You're going to read the discussion background, read all three parts of the initial prompt, plan your response using the discussion background, and create a new thread and answer all three parts of the initial post. Very important, it says cite a source from borrowed ideas or words before you submit your post. Check your grammar, spelling, punctuation, and or citation. I'm going to say to have a quality discussion post, you would need to use some type of outside reference. It also helps you with your content amount too, because you know that you have to have a specific amount of sentences for it to count for full points. But I will tell you that in this class, if you have a reference helping you with your response to the discussion question, you're well on your way to earning full points. And so remember that this is due by Wednesday at 11:59 p.m. Eastern Time, which would be your initial post. And then before Sunday, right? So here's, you can do your initial post before Wednesday, then you're going to respond to your classmates. You want to make sure that you can complete this one at least by Thursday, right? So you want to do like your second post by Thursday. You're going to review the discussion forum post and select something that's going to spark your interest from the question, and then plan your reply using any classroom materials. Make sure you write your cite or cite your source from borrowed ideas or words. And before you submit your post again, you're going to do what? That's going to be to check your grammar, spelling, punctuation, and or any citations. And then you're going to have your last post, because you need at least 3. I encourage you, if you have more classmates and you see that their posts are interesting and you'd like to reply, please feel free to do so. But make sure that you have a minimum of at least 3 posts. The third one, I'm going to say, make sure you do it either on a Saturday or on a Sunday, right? So you have one before Wednesday, the second one on Thursday, and then your third post either on Saturday or Sunday, 11:59 p.m. Eastern Time. So you're going to visit the discussion forum for this post that you're going to reply to on Sunday. Go to the discussion forum on a different day, review the discussion forum post from your colleagues, and select someone else's post that interests you. So make sure you're reading them because you want to make sure that your reply is going to be substantive and provide information to your colleagues and also to your instructor. So you plan your replies using course room materials, or then you're going to write your reply. And if you cite the source, that's of course is required if you borrow ideas or words. And finally, last but not least, before you submit your post, you're going to check for grammar, spelling, punctuation, and or citations. So that's the first tip that I want to give you in reference to the weekly objectives, and that's to focus on your discussion questions. So we're looking at the CPT book, and although it has overview, we're just talking about male and female on this particular segment. So let's look. In order to answer some of these knowledge point questions that I have gathered here, you need to make sure that you have your CPT book. So make sure that you have your CPT book handy. If you were looking over the male and female section, you should be have your CPT book within reach at this time. And we can work on these questions together, right, so that you can see what I am actually highlighting in here. So I'm going to grab the highlighter, and what I like to do when I'm doing my questions, I like to break them down. So this is a great time for you to see how we actually break these down, right? And what I highlight and what I abstract from the scenarios to help me reach my CPT code. So let's look at today's question. So a patient presents today for treatment of what, right? Treatment of a benign prostatic hypertrophy, or BPH. So you're definitely going to highlight that because that is going to be your diagnosis. Sometimes I tell individuals, grab a couple highlighters. You can use one color to highlight your ICD-10 code and another color to highlight your procedure code, if that's going to help you in the beginning. I just highlight as I read, as I go through. So when it's time for me to now code my scenario, everything that is important is already standing out, highlighted in front of me. So again, patient presents today for treatment of benign prostatic hypertrophy, and it says and, so this is included, right? And urinary retention. So that's two different ICD-10 codes, right? So they're present for treatment of that. And how are they going to have treatment? They are going to receive a transurethral microwave thermotherapy. So they have the acronym there, TUMT. And all they simply want to know is what CPT and ICD-10 codes are reported for this service. Okay, so the first thing we want to do is go ahead and we can look at the procedure code. So the procedure code, you can see it's only two to choose from, but we have to make sure we are choosing the correct one. So if you look at the procedure, they were receiving thermotherapy, and if I said what type of thermotherapy, it would be microwave, and it would be geared towards the transurethral. So let's use the index. We can actually go to the index for this. Turn to your index in the back of your ICD-10 book. It's nice that you have someone, we can actually work this out together. I'm glad you're joining me today and watching this presentation. Okay. So you may have to make sure that you look for thermotherapy. So when you find thermotherapy in the index, you notice it also gives you microwave. And let's see what it was geared towards. It says prostate tissue there, right? The other option would have been radio frequency. So they're both procedures for prostate tissue once you're back in the index and you're looking, but we're looking for the type of thermotherapy. And in our question, it said microwave. So there we are. There's one CPT code, 53850. Although we could have taken it from back here because we don't need to use the other code. It's not even listed there. We still want to verify it, right? So we could just turn to 53850. In your, I guess this would be the equivalent to your tabular section. 53850 is what we're looking for. All right, so we find 53850, and when you get there, it says transurethral destruction of prostate tissue by microwave therapy. So once we know that, that means we can now get rid of B, and we can also get rid of D. I would take my pen, select red. I want to get rid of what I'm not going to need, right? Because I don't want it to distract me when I am taking my question. Now, if you have your ICD-10 available, let's pull that out, because as you can see, the CPT code is now the same. However, if we look at ICD-10, I see that there's N40.0 and then there's N40.1. We don't have to look up the R33, that's your urinary retention, right? Because it's already there on both. But we need to know what the difference is between N40.1 and N40.0. So let's turn to that. N40.1. Give you some time. And remember, if you need to try and find the code, you can always pause the presentation and then come back. Okay, so I found N40.0 and N40.1. So N40.0, it says without lower urinary tract symptoms, right? Which would be, this is without. And then N40.1 says with lower urinary tract symptoms. Okay, so they do say they have urinary retention, right? They do have urinary retention. So there you would see your N40.1. Oops, let me go back. Sorry. Your N40.1 is with urinary retention. See, urinary retention is right up here. So that would be N40.1. So your correct answer would be C. Okay. C. And you can see the path that we took to get there, right? We went to thermotherapy, then we looked for the type, which was microwave, and then we saw the organ it was geared towards, which was the prostate. So very good on that. So we have quite a few questions, just to make sure that you're comfortable for this week's questions. And I just wanted you to see how we break them down. Okay, so we're going to do another one. This one is also in the male. Remember I said if you watched the first part of the presentation, kind of focused on some common procedures, and circumcisions were right in there in reference to the male genital system. So we have a question here, and we're going to turn to the codes. Well, let's see what we have. Let's see what we can pull out of here first. First, let's see what was performed. A clamp circumcision is performed. However, it says without, do you see that? Without dorsal block on a newborn. So it's on a newborn, and it's without a dorsal block. So we had to see, because remember there was a little tip. So as you can see, we're only looking at two codes. It's 54150 or 54160, and then I'll show you how we look it up in the index. But right now, what is test taking time? The reason you have options is so that you can do process of elimination or sometimes read and see the differences. Okay, we want to make sure you understand all of the steps when you're doing your work. So let's turn to CPT code 54150 first. 54150. Okay, and we'll see 54150 is a circumcision using a clamp. So I did say a clamp was performed, so we have that part right. And it says, or other device with, and it says with dorsal penile or ring block. And this one said without dorsal block. But it also said it was on a newborn. Okay, so let's look and see what 54160 states. Circumcision surgical excision other than clamp, but this one said it was a clamp circumcision. This one says other than clamp. Device or dorsal slit, neonate 28 days age or less. So that would be neonate, right? And it also said neonate, and this one said newborn. So neonate and newborn. So, and then the 52, remember modifier 52 is when it's performed without a dorsal penile or ring block. So we're maybe looking at 51550, or do you think it's 51560? It would be 50, right? Because that's the one where if you report 54150 without modifier 52, when performed without a dorsal ring block. So it would be 54150, and we would use code modifier 52. Okay, and if you're looking in the index, we can do that really quickly. You go to the back, you'd look for circumcision, then you would look for excision, and then neonate. And let's get that back there so you can have a little practice before we move on to the next question. So remember, we're going to circumcision, which is in the back of the index, and we go to surgical, and then you'd look for neonate, and you'd see those two codes there, 54150 and 54160. Okay. But because it was used without, you would append modifier 50. Now let's move on to the next question. This is in reference to another circumcision, but it also says there's something else going on with it. Do you see? It says circumcision, so we actually have that there. And then it says with adjacent tissue transfer. So there's another procedure happening, an adjacent tissue transfer, and it was performed on a 2-month-old. Sometimes I like to highlight the age just in case I may need that to help me with my code selection. So we know that adjacent tissue transfers, if you were coding, if we've done coding for the integumentary, that's where those codes would come from. So they would begin with the number 1 for all integumentary codes. My thing is that they also did a circumcision. So if we just choose A, that's not going to involve the circumcision. That's only going to be the adjacent tissue transfer. So we actually can get rid of A. That's not going to be one of our contenders. So let's strike that out. Okay, and then let's look at the difference between 54161 and 54163. So 54161 would be because they're older than 28 days. So the full description of that CPT code would be circumcision, surgical excision other than clamp device or dorsal slit, and we would pick older than 28 days. Well, older than 28 days would be over a month old, and they said that this child was 2 months old, so we would have to use 54161. It does not mention anything about the tissue transfer, which is going to be that 14040. We can just double check, although that's not the section we're in this week. I just want you to see the definition. So we can turn to that code. That would be 14040, and that says adjacent tissue transfer. So you would definitely need that. And it says genitalia. So that would be that. So the correct answer would be D as in David, and we can just validate that. And there you can see it's D. All right. And let's let's just talk about some need to knows. I call these need to knows because they're going to be helpful for you with your week, maybe on your assessment or on your quizzes or interactives. So I just wanted to just cover a few of those bullet points or things that you need to know. Going back to the male and female section, remember that you have illustrations within your CPT as well as your ICD-10 pertaining to the male and female genitalia. Now, I just wanted to mention that there are accessory organs of the female genital system, and those areas are, so remember these, what I'm about to mention are what we consider to be accessory organs. They are the uterus and the fallopian tubes, right? Okay. Accessory organs of the female genital system include the uterus and the fallopian tubes. And for the male, the epididymis is a gland located in the scrotal sac. So the epididymis is a gland located in the scrotal sac. So that's in reference to the males. Okay. And the distal end of the penis, the distal end, is not known as the foreskin. Okay. That is not known as the foreskin. And a surgical procedure performed through an abdominal incision. So we talk about that when we talk about deliveries or CPT codes for deliveries for mom. A cesarean would just be an incision that is aligned within the abdominal area. And they do this to deliver babies, right? So let's look at that. That is called cesarean. The CPT code, I just wanted to just add that in there for the delivery for a cesarean, is 59510. But the name of the procedure is called the cesarean. So those are a few little tips I'd like you to just remember. I have a few more that I'd like to cover. Okay. The next one, drainage of the urinary bladder can occur by catheterization or by a surgical procedure known as cystostomy. Remember, cysto is pertaining to the urinary bladder. So cysto is pertaining to a urinary bladder. The ending or the suffix ostomy means it's an artificial opening, and they would create an artificial opening if they are going to have a catheter inserted. So then that procedure would be called a cystostomy. Okay? And they place the catheter in there so that they can drain the bladder. It's called a cystostomy. And back to the delivery of mom. So this is back in the maternity section in the 50,000s. Okay. The global delivery service codes include antepartum, which means before, delivery, that means when mom actually delivers the baby, and postpartum care. Postpartum care is considered up to 6 weeks after mom delivers. And remember, even though mom has delivered, even 6 weeks after delivery, you're still going to use the O codes as far as ICD-10 codes. They're still going to be listed first and used up to 6 weeks after mom has delivered. And back to the male, the vas deferens is also referred to as the ductus deferens or the seminal duct. The seminal duct. Okay. Mark Gates, this is a scenario here. And Mark Gates was in a motor vehicle accident that resulted in a major laceration of the bladder. A cystography, remember cysto is pertaining to what? The bladder. And raphy is basically to sew or to suture. So when you hear or you see the term cystography or anything that ends in the word raphy, that means there was a suture. In this particular instance, there was a suture of the bladder. So a cystography was completed to suture the bladder. So if we had to look up the main term to find the ICD-10 code, not the procedure code, which would be cystography, but the ICD-10 code, we'd have to look up the term laceration. So laceration would be our term, and then we would look for the location, and the location would be the bladder. Okay. That's just in reference to urinary, to like the urinary system. And postpartum care includes services, just to reiterate, following birth, that magic number is 6, up to 6 weeks after delivery. So we're getting a really good overview this week. Again, if you need to stop and while you're searching for the terms in the index or just reading about them in the tabular or just associating them to what you've read this week in your learnings, it's important that you make little tips and you highlight so that it will help you when you come across those questions again further on in the week, or even when you go off into your new careers and industries. You'll have your tips there. Let's go on to our other knowledge check question. Okay. Dr. Pan completed a complete radical vulvectomy. So this is the procedure here. Let's get that highlighted. A complete radical vulvectomy. We're going to look this up. We could even use the index, right? Because vulvectomy is a terminology word, and you can always look up your terminology words in the index. And it says with, so it's giving you something else, bilateral. Bilateral means it's a procedure that has been or is performed on both sides. And it says inguinofemoral. Inguinofemoral lymphodectomy. That means they've also taken out, sorry about that, also taken their lymph nodes. And it says the appropriate code to report for this procedure. I have the code listed there. Sometimes I like to do things a little backwards. We reverse it so that you can see, and this is for teaching purposes, the terms and how we got there. So let's turn to the code 56537. 56537. So 56537. So if we go there, we can see that it's indented, and we have to look at the parent code, which would come from CPT code 56633. That is a vulvectomy. It also says radical, and it also says complete. So the 3 terms we need are definitely in the CPT code. And then when we go down to 56537, okay, let's get there, 56537. When we get there, it says with, let's see, 56537. It says with lymphodectomy. Do you see that there? Because it has your inguinal femoral. So it's all there with lymphodectomy. And then for our last example, we have code 50060. 50060, and let's see what that one's talking about. 50067. I'm sorry, 50060. Let's go there. And this would be in the urinary section. 50060. Let's see what 50060 states. Nephrolithotomy. Yep, that's your procedure, and that's also your terminology word. And it says removal of calculus. So that would be your terminology. This is what you would look up actually in the index to give you that. And it would also tell you it's for removal of calculus. All right, let's continue on. So this is another question that we're going to have to dissect. So it says, Mrs. Sweet has been diagnosed with cancer of the left kidney and ureter. So we can already tell this isn't a question in reference to the urinary system, right? And it says, and the left ureter. You can already see we have our LT here for the location, which would be left. And now we want to see what was performed. And it says a laparoscopic nephrectomy with total ureterectomy. So did you know that you can actually go to the index and just look up all the procedures that are performed laparoscopically? So let's do that. I'm just going to show you a little different way. Hopefully this works. It should. So you're going to go to laparoscopy, right? We're going to go to laparoscopy. And then remember, everything is going to be in alphabetical order. So you can look for nephrectomy. When you get to nephrectomy, it's going to give you a code range, 50545 through 50548. So let's turn to the code range, 50545. Let's get there. 50548. Okay, so 50548 states, it says it's a nephrectomy, which you have to know that it's laparoscopy. So you see it's indented where you see 50548. If you look over to the left page, you'll see the heading starts laparoscopy. So all of these procedures are laparoscopically performed. So it would be laparoscopy surgical, and then you'd go over and say nephrectomy with total ureterectomy. There you go. That would be how you would get your 50548, and the LT modifier is appended on there to let you know that it was performed on the left side. Okay, so these were just a few questions that we wanted to cover just to make sure you understand how to abstract. And remember, you have all of your instructors are available. Their office hours are posted along with their contact information if you have any direct questions relating to the male and female. Also, we covered just a few tips on what to look for or in reference to answering your discussion questions. Remember that main post is due on Wednesday, and you need to respond to your colleagues 2 additional days in the week. I would suggest Thursday and then either a Saturday and Sunday. So thank you for joining. Thank you for joining this week. Have a good day.